Thank you so much, and it's a great pleasure to be here. I think the great panelists, before we start, request you to put your hands together before we start, because it was not good enough. Well, Your Excellencies, esteemed guests, and colleagues around the room, I'm really have the pleasure to be here with you today. On behalf of myself, my name is Ayman Mukhtar. I am the regional president for Viatris, which is a big pharmaceutical company across the Middle East, North Africa, and Eurasia. And I'm here on my behalf, on the behalf of the healthcare sector across the Harvard Business School, GCC. And I'm really thrilled to be here today with the great panelists who represent a great variety of speakers from research, from academia, from professors and doctors, and from even the industry and the private sector. And before I start, I want to reflect on something that was really kicking my mind before even the day started. Potentially a few years ago, I was on a stage and I was giving some speeches to different audiences. And I always know that challenges will come across our way. But it didn't cross my mind that the world will stop in a few weeks when the COVID hit all of us and caught us off guard. And potentially at that point of time, every single individual started to realize the value of healthcare. Leaders across the globe started to pick up the phones and call healthcare providers, value their inputs. But also it brought us to a completely different chapter where capabilities and skills have been completely transformed. And I'm really thrilled to be here today and open the topic of the talent and in the healthcare and the changes that we see. We all know that there is currently a big shortage in many countries, including the US, for example, where the impact of COVID has impacted the number of healthcare professionals and the shortage that they will see in the market. We know quite well that it's not only about the number, but it's about the skills that is needed to move there. That brings me to the first part of the panel, and instead of me seeking to introduce the great panelists, I would request each one of them to please introduce themselves, but to tell the audience one word to represent their passion as well. This was not in the script, by the way. Doctor.
Assalamu alaikum. Good afternoon, everyone. It's a pleasure to be here, and thank you for joining us today. So my name is Fatimah.S.Alhamlan. The hardest thing is to introduce myself because I feel I'm all over. But believe me, it's all about health and wellness and promoting health and wellness, especially among women. So I'm a virologist. I work with viruses, especially the viruses that cause cancer. And how I ended up as a women's health advocate is when we started to do our research, we found out women, they are not aware about the viruses that cause cancer. So, and the problem not only in Saudi Arabia, we did a GCC research, and it turned out to be half of the patients, they die of cervical cancer because they are not aware there is a vaccine and there is early screening tests. That's where I decided to establish Rofaida as a women's health organization just to raise awareness and to talk freely about this sensitive topic in this culture, because I believe we all share this in the GCC country where we really have hard time to talk about sensitive issues. And women's health is a priority and we need to talk about it. That's where I'm wearing the advocacy hat with the civil society organization, and still I'm doing my research and innovation at King Faisal Specialist Hospital. And believe it or not, the impact in Rofaida is greater because when I'm a researcher at King Faisal, I'm only one. But when I'm at Rofaida, I'm a catalyst where I have a pool of experts who are interested to help and serve the community. And we engage the community with us. We listen to the community. And we became really stronger. And we have collaboration with the GCC country. And we have collaboration with international as well. This weekend, we are collaborating with Houston Methodist also to talk about women's health rights. Back to your point, can I mention something I'm passionate about? I would say women's health, of course. Thank you.
Thank you, Doctor.
So now she has a new member to the team with this introduction. Thank you very much. Thank you, Saleh. Thank you, HBS Club, for this opportunity. And thank you, Ayman. I'm really honored to be here. My name is Wissam Haddad. I'm a pharmacist by education. However, my passion is learning and development. And that's what I have been doing for almost half a decade. So I really hope I can add value to this very amazing discussion today. Thank you.
Thank you, sir.
Hello, everyone. Ayman, thank you so much for having us here. It's really an honor and a pleasure to work with you today and all this distinguished panel. I am Freddy Jimenez, 29 years of experience, multiple industries, Chamber of Commerce, Citibank, pensional funds, and luckily the last 12 years, I am working with Pfizer, and currently I am the Regional Innovation Lead for Africa, Middle East, and Russia. To your question, what is the passion? And I would like to summarize just is as how can we impact patient lives? That is. Thank you.
Hello, everyone. It's a pleasure to be here. Thank you, Ayman. And I guess in the past, when I used to tell people that I'm an epidemiologist, people used to ask me, what is epidemiology? But after COVID, I don't need to explain what that is anymore. My name is Yasmine Altwajiri. I'm an epidemiologist and a research scientist at King Faisal Specialist Hospital and Research Center. And for the past 13 years, I've been working on mental health epidemiology, trying to understand the causes and the burden of mental health in the region. Thank you.
Thank you, Doctor. So, great introduction from great leaders, and that brings me to the first part of our discussion related to the fundamental changes that we start to see in the workplace, particularly in the healthcare sector. So we started to see specialties emerging. We started to see technologies shifting the way that we think about healthcare. And I would like to address that with the first question of, in your field, what is the most changing patterns that you started to see impacting the future of healthcare? And if I start by Dr. Yasmine to target that and move it to Freddie afterwards.
Sure. So our healthcare as an industry has undergone tremendous transformation recently, whether it's due to digital technologies or shifting demographic or increased patient awareness and patient expectations. As a result of that, there are some patterns that we can predict happening right now and will continue to happen in the future. First one, obviously, is the the increased use of digital healthcare technologies, whether it's through people who are adopting telemedicine or health wearables and devices that capture our healthcare data, or even the health apps. So these technologies are going to become more and more involved in delivering healthcare, access to healthcare, increasing patient engagement. So digital technology is obviously something that we're going to see more of. The next thing we're going to be seeing more of is precision medicine, increased evolution of the things that we're discovering from genomics and proteomics and data analytics will allow us to become very, very precise when it comes to delivering healthcare treatments to patients, and we're going to be seeing more and more of this in the future. The other thing that is getting integrated increasingly in our healthcare delivery is machine learning and artificial intelligence. That's obviously becoming more integrated every day in the innovations that are happening in the healthcare industry, and it's going to increase. And then finally, the one of the things that are really important is healthcare diseases have become extremely complex, and we cannot expect that the solution is going to be handled by a single entity or a single sector. So it's going to require collaboration between multidisciplinary teams. So a disease would need the support of scientists, clinicians, engineers, policymakers, in order for them to really make an impact. So for example, the global obesity epidemic, the solution does not lie only in the clinic. You will require scientists to understand the cause of the problem, clinicians to find the treatments, engineers and urban planners to design cities that are more conducive to exercising and improved lifestyle, and policymakers such as Ministry of Commerce who have to impose taxes on foods. So the future generation of healthcare professionals will have to become more adept at each of these factors and be able to integrate all of these changes into their practice. Thank you.
Thank you, Doctor.
Thank you, Doctor. If you allow me, I would like to answer from the pharma company's lens.
Please.
So I think that it's important to provide a little of context, what has happened during the last years. 2019, pharma companies were not good with the digital interactions, right, with the digital model. So as an average, the pharma companies have just 5% of the interactions as a digital interactions, 5%. Then as you mentioned, COVID came and we moved from 5% to 100% digital. So it was a very interesting transition. Then we start learning about the digital channels, educating ourselves, educating the customers, and we start discovering the power of that interaction. So instead of waiting for the doctor in the physician office, we can adapt, and we were adapting to the doctor schedule. So even we were taking calls 11 p.m., Saturdays, Sundays. And why that was important? Because at that moment, we were not taking time of the doctor with the patients. We were really having better conversations. No? The doctor was in your house, in their house, taking coffee. So it was impressive. So that was 2020. 2021, we start learning, improving, but then something happened. Channel fatigue, no? Digital fatigue. And last year, for your benefit, most of the pharma companies are using the same CRM, so we can see almost what all the companies are having. So last year, first semester, we received a shocking report, and they showed that 85% of the interactions were again face-to-face. So we say, oh, come on, we moved from 5% to 100% and now 15%. So all of our assumptions were not so accurate at that moment. So now, and to their question, so we were asking the talent to move to digital, and now talent are moving to face again. So now the question is, what does the future look like? Are we going to return to the old model, where 95% of the interactions are face-to-face? And the answer should be no. No, that will be so sad if we didn't manage to learn and to adapt. So my personal reflection is two things, and for the talent that we need to develop and the capabilities that we need to develop. The first one is relevance. So now we need to really be more relevant than before. Now it's not more about the quantity of interactions. Now it's really how we can have less but more relevant interactions. And the second reflection, understanding the customer patterns and the customer changes in the preferences, is real-time model. We really need to understand what is working with each one of the single customers. If we have 100,000 HCPs, if we have 100,000 customers, we really need to understand each one of the 100,000 patterns, right? So that means for us that we need to understand what is working, what no, and adapt in real time our model, our interactions. So for me, that is the reflection so far.
Thank you, Freddie, and thanks for the great answer by both Dr. Yasmine and Freddie. And now, if I want really to hear from you, Wissam, from educational point of view, what strategies can we develop in order to address those changing patterns?
Yes, thank you, Ayman. Well, to be more articulate about it, I had to go and do some research before I come here. And one of the most interesting research that actually we built on in our learning and development in healthcare at cross sectors is the future of jobs for the World Economic Forum. And what is really fascinating that the healthcare has been always, even with the COVID that accelerated all of the changes, whether it's digital or non-digital or even different levels. But we can see a very high, interest in the core skills, not the technical skills. All people in the healthcare, they have systems to follow. They have CLPD, they have lifelong learning. But when it comes to the core skills that we are really talking about now, you will be amazed to know that the first one is analytical thinking. The other ones, they will go for the problem solving, the complex problem solving. Not anybody, whether we are, leading organizations, or we are employees or employers, or even entrepreneurs. This is a must to have. Anyone has to develop their skills on those three. And even after that, we will have a couple of skills that talks more about resilience, agility, flexibility. After that, as per those reports, we will talk about the digital readiness. The digital readiness now for us, actually, where I'm working in the leading learning and development, we're taking it over the whole organization. It's not for one person at all. One other thing that was really significant, very specific to the healthcare, is media and communication. We give trainings for people in healthcare, for doctors, for medical reps, for people who are leading organizations, especially pharmaceutical companies. You're not allowed to speak whatever you want to the customer, to the patient, because whatever you have said, many people were giving their opinions in the vaccine. And guess what? People now, us as patients, so I'll wear the hat of the patient, are more aware. We have high expectation, and there was a lack of trust between us as patients and as the healthcare systems. So we don't want to, hear the doctors. We go with the doctor with our research. We know what's the medicine. My friend told me about that. The social media, and it's all glam, and all the people are using it, is also affecting us as people, as patients, which gives more, pressure on the healthcare that they need to educate the doctors, the nurses, how to talk to the patient and how to address the patient, whether it's one-to-one or a mass. So these are the reflections on the skills that we need, whether it's a cross-sector or specifically for the healthcare, to lead this transformation.
Thank you, Uta. And instead of moving on the same trait and move to Dr. Fatma, who is a known scientist and has played a significant role during COVID, completely advocate for women empowerment. And I would really tackle it and move the discussion towards a subject that is very dear to my heart. And I always tell that I came through life through a woman. I dedicate my life to my daughter, so it's another woman. And I'm surrounded by huge level of talents from female colleagues. And that brings me to the core of the question that I want to address to you, Dr. Fat, that what is your assessment for the current status that we have for the women in healthcare?
Well, for women in healthcare, actually, it's progressing. When we are talking about women in general, when it comes to rights, human rights, and here in Saudi with the legal reform, we had the legal and social reform. That means women are autonomous, and this is one of the transformation that took place when we are talking about women in the healthcare sector and women as a patient. This is what we are advocating for. And also we started to have women's health clinics, women's health fellowship programs, so even the specialty was really advanced in that field, women mental health as well. There are so many opportunities when it comes to women in healthcare. And even with the knowledge with being in a healthcare, you can work wherever, because health and wellness, it's integrated wherever you go. You cannot, if you are specialized in healthcare, you always can work wherever. And now we saw one of the big projects, PIF, they ventured into women's health and fitness and wellness which is Kayani, company. It's a company. But again, it's a women's health base. So as you said, women, it's your daughter, it's your wife, it's your mother. So we all care about women as part of the community. Now we need to have more opportunities for women to thrive and to grow. I always say the difference between health and wellness. Health, you can survive because the definition of health is not the absence of diseases. You still have a disease and you can manage. Wellness, it's beyond. Wellness is you thrive. It's not only you survive. And this is actually the trend that's taking place in Saudi Arabia. If you look at anything happening with the mega projects, wellness is part of it. And this is what we are trying to promote. When it comes to women in leadership position or women's advancing in the field in healthcare, it's actually a problem worldwide. Women, they thrive in the beginning, then they get stuck in the ladder. But again, I think there is progress. It might be slow. And not only in our region, it's worldwide. It comes even a problem with the publications, with the funding, with getting tenured in the universities. Women, there is always a bias there. But in order for us to move forward, my advice always to anyone, invest in yourself and keep learning and keep progressing. You don't have to have a title to lead. You always can make an impact. We always work and make an impact even with our family, with our teams, within our capacity. We always can make an impact. And with that example, and just to show you the opportunities that's available right now for women, I will give you an example. You all know the story, but to bring it back to this context, it's Rayana Barnawi, the first astronaut. She's our colleague at King Faisal Specialist Hospital. She's a researcher. She was doing her work for years. She worked on herself. And when the opportunity came, she was ready. And literally, the sky was the limit. She was the first female to go to that space. So again, for any women here in the room and thinking about the career path, I think whatever you are doing, just do it well and have an impact and have a purpose and just grow in this field. And one day you will land wherever you want to be.
Thank you. Thank you so much. And honestly, building on what you said, there is a piece of research that is done by McKinsey in this part of the world, which is particularly in the Middle East, which highlighted the importance of speaking up.
Yeah.
So as long as the male leaders should continue to advocate and empower women development,
Sure.
I join your force and your voice to ask female colleagues to speak up. This is where the joint forces will move. And since we spoke about women empowerment, we spoke about capabilities, we speak about the bigger picture of health. And we always say there is no health without mental health. And we have across the panelists here, Dr. Yasmine, who advocated a lot to the mental health and mental health strategies. So the question goes back to you and focusing on mental health. And as a scientist and a researcher, could you please give me some findings from your recent research, potentially that is not known yet?
Even the main known ones are not known yet to
Correct.
a lot of people. So we did a research project known as the Saudi National Mental Health Survey. It's one of the largest mental health projects in the whole region. And I want to start by saying, although the project was done in Saudi Arabia and among the Saudi community and in the Saudi population, our Saudi population is very diverse and it's very similar to all the GCC countries. So we share similar socioeconomic development, similar histories, similar genetics, even family relations. So I think the results of this project are generalizable to all the GCC countries. So what I'm about to share with you is something that is not only relevant to the Saudi community or the country, but to all GCC countries. So we did a project because we wanted to know how big a problem is mental illness in the country. There was a lot of talk that we were receiving from World Health Organization and from Western countries talking about a global mental health epidemic. People here thought thought that we're immune to this. You know, our society, our families, our culture is extremely protective. We're immune. We have nothing to worry about when it comes to mental health. So, but for some reason, our leaders thought that we should really make sure and pay attention to this. So we did a national survey among people in their homes all over the country, and we conducted an very, very extensive diagnostic survey among them, and we came up with results that everybody was shocked to hear about, that 34% of the Saudi population has had a mental illness at some point in their life. And then when you dig down deeper, there's no difference between males and females, and it doesn't concentrate in any particular socioeconomic level. So whether you're rich, middle class, or poor, it's the same risk among all of these levels. But the thing that is really concerning is that among the people who do have mental illness, the majority of them are youth. And this is a concerning why, because in the GCC, our populations are mostly, predominantly young in age. So we're planning that these young generations are going to be developing our countries, they're going to be taking over, these are the future leaders, and yet we know that they are the highest risk demographic in the population for mental health problems. What is being done about it? Unfortunately, right now, we don't have quick solutions other than awareness and trying to point them in the direction of what exists with regards to solutions, but they're very, very few. Our resources, our infrastructure is not enough to provide services to the large wave of people who are suffering from anxiety, depression, and all of these different problems that lots of people are faced with. And so now the next stage is we're saying, now that we know that this is a problem, what can we do? How are we going to help these young people? So we began planning for a new research project which will identify culturally sensitive mental health solutions for young people. And of course, this is a very time-consuming project. It will require doing lots of clinical trials, lots of testing. We're doing it in collaboration with leaders in the field at University of Berkeley, Harvard Medical School, and University of Michigan. And we're going to use precision medicine because not every mental health solution suits everyone. So we want to be able to know your characteristic is A, you need to take solution number 3. And if your characteristic is B, you need solution number 1. And so this is the next stage and the next phase of our research. So hopefully within the next 5 years, we'll have very advanced solutions for our young people. Just as a final note, one of the things you asked me, Ayman, is that how can we advise and how can the community be prepared? I think it's important to know that nobody is immune from this, and for business leaders, they have to realize that mental health leads to absenteeism, presenteeism, and loss of productivity. So ultimately, it does affect the bottom line of your companies. So it's really important to pay attention to mental health of your colleagues, of your employees, and of your families.
Thank you so much. So it was really a pleasure having all the panelists and having a lot of education. I got a lot of learning personally from the panel, and I know that no one is immune, as you said, from health. And just to remind all the audiences that we invest a lot in many of our projects, but remember that the biggest investment that you can do and the biggest asset you own is your health. Thank you so much, and wishing you a wonderful day, and good luck for all panelists. Thank you so much.
Thank you.
Thank you very much for